Thank you very much, Program Director, and Excellencies, all protocol observed. Thank you very much for the invitation, CTO. Let me share some few challenges that we experience in South Africa and some of the interventions that we are making. About 77% of the population in our country have got access to the internet through either mobile, Wi-Fi, etc. We have got an ambition to have 80% of the total population having access to the internet in the next 3 years through implementing our broadband policy called SA Connect, which I'm going to talk about it a bit later. First, just to talk to the challenges and to say that while internet access continues to improve, several challenges remain inhibitors of universal broadband connectivity, and this include the following: affordability of mobile data. The high cost of data remains one of the key barriers of internet usage, in particular the extent of internet usage. The cost of data in our country remains among the highest in the world. We are ranked 135 in 233 countries worldwide, from the cheapest to the most expensive. We are currently working on implementing the recommendation of the market inquiry on the cost to communicate by the Competitions Commission. The other impediment is access to and affordability of suitable devices to access Wi-Fi, which has been spoken about. I don't think I need to elaborate on that. And also digital literacy. For instance, during the COVID-19 lockdown, 64% of the learners who could move to the online learning platforms reported that they had difficulty adapting to online environment due to the general lack of digital literacy, among others, among the learners and the educators. So the challenges of Wi-Fi connectivity in particular include some of them: the limited backhaul network capacity in rural areas, for instance, to carry internet traffic, which also affect the quality of the broadband connectivity, inadequate funding to maintain deploy Wi-Fi networks in rural communities, Wi-Fi-enabled devices which are out of reach for most of the people, and unreliable electricity supply. As we know, we've got big problems in our country with energy supply, with Eskom having to move from various stages, stage 1 up to stage 6, where we shed the use of electricity. And so what is the solution? In order to improve connectivity, in South Africa, we designed and adopted a broadband policy which we call SA Connect. So through this program, for which we have secured 2.5 billion from the fiscus for the next 2 financial years, we will be rolling out ICT infrastructure across South Africa to ensure that our population have got access to the internet by 2024. There are 3 components of this broadband policy. The first one entails the rollout of community Wi-Fi hotspots, about 33,000 of them across the country. The second one is community connectivity, where the state will be providing the backhaul capacity through the base stations and will be working with the ISPs and the mobile virtual network operators who will be providing networks, the broadband services directly to the communities from the base station. We are targeting about 5.8 million households. The third aspect of the policy, which involves working with the mobile network operators. In June of last year, we released the much-needed high-demand spectrum to allow the operators to decongest our networks and deploy 5G, 4G and 5G networks across the country. So the release and licensing of this spectrum involves social obligations which we had to agree with, where we have agreed with the mobile operators to connect about 18,000 public schools, 6,000 health facilities, public libraries, and 8,000 traditional authority sites over the next 3 years. So to date, as part of SA Connect Phase 1, we have connected 970 government facilities. 80% of these facilities are connected via wireless technologies, with Wi-Fi connectivity provided at each facility. On the digital literacy front, we are rolling out a massive program of digital literacy, which we call it Yarona Ambassadors Program, where we provide digital skills to our citizens utilizing one of our entities called NEMISA. Thank you very much, Dr. Ngare.